am pleased to be able to have this conversation with Professor Diana Kenny from Sydney, Australia, whose book Intransigence, Gender Ideology, Social Contagion, and the Scandal of Youth Gender Medicine has recently been published. Diana has been an early and vocal critic of youth gender medicine. Thank you, Diana.
Thank you, Kelly Lynn. It's a pleasure.
So let's start by asking whether there have always been transgender people. Transgender advocates are like, we have been around forever. So where do you see that?
Well, it is interesting that gender ideology often has a kernel of truth hidden in their tissue of lies. There are documented cases of transgender people in different cultures, in different histories, different timelines, but there is a very minimal recorded history. The transgender lobby would have us believe that there have been other times in history where the same kind of increase in globalization of transgenderism that we're seeing now has occurred at other times in history, but it actually has never occurred prior to the 2000s. So that's the first thing. The second thing is that they often invoke non-Western cultures to prove that transgender people abound across the globe. But in reality, the concept of transgender in Western and non-Western societies is very different. The concept of transgender in non-Western societies is much more socio-culturally based, as opposed to Western society, where it's an individualistic thing. It's this internal sense of gender that trumps everything. It trumps science, it trumps common sense, it trumps medicine, it trumps biology. That if you have this internal sense of being born in the wrong body, then that is what has to be attended to. Whereas in non-Western cultures, it's socio-cultural. For example, in countries in the Pacific region, in the Pacific Islands, take the example of Fiji,
Right.
it's much more widespread. There's a group of people there called the Fa'afafine, and these are biological boys who were born completely normally as biological males, but who were forced by their parents to become females if that family doesn't have any biological female children. So one of the boys is chosen to be a girl to help mother with all the household tasks and to bring up the family and so on, and to look after the mother in old age. These are not children who go up to their parents and say, I've been born in the wrong body and I must have a transition process. These children are selected with no consideration for their needs, their emotional well-being, or anything of that nature, to become a girl for the family. So that is a very, very different presentation compared with what's happening in Western cultures. And the reverse happens as well. In Pakistan, for example, there are families who only have girls, so they will choose one of their girls to be a male. And the reason for that, again, is sociocultural. It's because males are allowed to go to school, they're allowed to work, their physical safety is protected, whereas girls in these cultures are very vulnerable to sexual abuse and exploitation. So the family will choose one of their daughters to be a boy in the family constellation. Often it's so that boys can get a job, whereas girls can't. And they're safer and more protected from violence and exploitation. But at puberty, they're expected to revert back to being a girl. And some of these young people are very seriously disturbed by the time puberty hits, because they've grown up thinking that they're a boy, and the transition back can be extremely difficult. It leaves them with a lot of emotional pain because they've been brought up as a boy to puberty. I could go on. And there's a number of other cultures where we see these social transitions occurring that have got nothing to do with the Western concept of transgender.
Right. The other thing I'm aware of is with the more patriarchal native cultures. Um, it is the males who fail to pass the rite of manhood. So they never can be warriors. So they were never under the taboos where a warrior can't do woman's work. And not being a warrior, they could therefore do women's work. However, they were never allowed into women only spaces. So they were seen as a failed male.
Yeah, so that's another example that you've just given. But these are all decisions that are externally socio-culturally driven. They're not coming from within the young person. You might have heard in Thailand, they have a group of people called the Katui, and that means lady boys, and they're effeminate males. They were possibly, some of them are possibly gay, and some of them are transgender women. And they've existed for a long time in Thai culture, but their definition is much broader than the Western equivalent because it actually includes all non-gender normative men, regardless of whether they've transitioned or not. So they might just be effeminate males, or they might be gay males, or femme gay males. So transition is an essential to get that title in Thailand. And their counterparts are locally known as Toms, and that comes from the English word tomboys, but it's been shortened to Toms in Thailand. So they have a very strong social imperative to being included in that group. It's very improper and inappropriate to use all of these socio-cultural factors in non-Western societies to support the notion that transgender people are everywhere. The word transgender or cross-dressing mean very different things in different countries.
So they're taking very different ideologies and putting them all under one umbrella and calling them something they're not.
Yeah, that's right.
It sounds to me like it's part of what is wrong with gender ideology in general.
Yeah, that's just one of the mistruths of gender ideology. There are enormous numbers of mistruths. There's a lack of science, a lack of truth, a lack of intellectual integrity. For the people prosecuting the idea of gender ideology, it's a flawed concept, and they will just use any information from a whole range of other disciplines and belief systems to shore up this house that's built upon the sand.
How much is suppressed? When I was a trans activist, we developed a phrase that we sent around to ethics committees, to research departments at universities, asking them to refrain from further engaging in research that served to marginalize and stigmatize an already vulnerable population, so not to um, allow research to study those areas. And one of the things that was beginning to be talked about in 2000, 2008, and I can't find anything on it right now, is the psychological effects of taking cross-sex hormones. So, how much does testosterone impact a woman's emotional regulation? And how does estrogen impact a man's ability to regulate his emotions? It looks to me to be one of the areas where research um, is being suppressed and nobody wants to uh, ask questions into an area that might upset the trans activists.
Yeah, that's right. It's a very understudied area. Even now, there's not a huge body of work on the emotional impacts of cross-sex hormones. There's been a lot more written and understood about the physical impacts. And because they're so profound, there's been less attention paid to other aspects of the effects, such as cognitive effects and emotional effects. There has been some interesting research that looks at the cognitive damage that puberty blockade does on cognitive development, not just biological and sexual development in children. The research that is available suggests that children lose IQ points as a result of being placed on puberty blockade. And there's been some interesting research done on sheep who've had their puberty blocked, and the sheep become less intelligent on the sheep scale of intelligence. So there are
Oh,
animal models that have shown that puberty blockade affects cognitive development. One of the most interesting studies that if you look at Down syndrome children and you give them more puberty hormones, not the
right.
puberty agonists, the gonadotrophins, they actually improve these children's cognitive development. So there's a body of work now that's coming together to say puberty blockers are not safe and reversible, which is the mantra propagated by the trans lobby ever since the whole thing started. They are not safe and sometimes they're not reversible, particularly if children are being kept on them for an extended period of time. So we know that puberty blockers are not safe or reversible. Um, so did you want me to say something about testosterone and estrogen as well?
First, this idea of being reversible is based on precocious puberty treatment, by what I understand, where they're justifying the idea of reversible because with precocious puberty, they stop the blockade and allow puberty to go forward. Is that correct?
Well, this is a very good example of where there is a kernel of truth in a tissue of lies. So, precocious puberty is the very early onset of puberty in children, and sometimes it can occur as young as 2 years of age. Um, and it's far too young for a child to be experiencing puberty. So these children have their puberty delayed, not blocked, until they reach an appropriate age to experience puberty. And then the drugs are withdrawn, and the child will go through a natural pubertal process at the appropriate age. That's a very different scenario to the children who've been normally developing and are about to enter puberty at the right age, and then they have their puberty stopped. So they're saying, look, puberty blockades are safe because it's been used medically on these precocious pubertal children and it's been approved, but they're very different populations and they aren't comparable.
So precocious puberty is an approved use. It's not considered an off-label use.
That's right, yes. So it's on label for precocious puberty and off label for children presenting to gender clinics claiming that they've been born in the wrong body.
They're looking at children who have precocious puberty, and they're looking at the long-term effects of puberty blockers on these children. And they're beginning to massively reduce the amount of blockers they're on so that they're no longer attempting to block puberty. They're just attempting to slow it down really hard because they're finding the effects on bone development, cognitive development, and other things when these kids are hitting their mid 20s and early 30s.
Yeah, I mean, any medical treatment that's been implemented with precipitous haste without long-term follow-up data is really quite irresponsible. And you're absolutely right, that these detrimental side effects may not be detected for some years after the prescription of such drugs.
So where researchers had thought, okay, the puberty is too early, so we're just going to block it and then allow them to go into puberty somewhere between 10 years of age and 13 years of age so that they're with the cohorts of children that are already starting puberty. Now they're going, okay, we need to cut in half or lower the amount of blockers we're giving them so that we massively slow down, but still allow the precocious puberty to move forward at a slower rate.
Yeah, we have to practice according to a principle of the least invasive treatment in order to get the result that you want. So if you've got a mild headache, um, you're going to take Panadol. You're not going to take endone, for example, and you
Right.
might only take one or two if it's a mild headache. It's the same kind of principle. The Hippocratic Oath says do no harm, at least do no harm, which obviously, the gender ideologists and their adherents have forgotten that that is the first principle of practicing medicine.
Yeah, I was involved in trans advocacy in the 2004 to 2010s and then a little bit in the mid-teens. So the justification I was hearing at that time was that transitioning kids would result in better outcomes for adults. Like if the researchers could identify trans children, um, the surgical alteration of the child's body would go better if the individual didn't go through puberty. Um, but what's being found now is that the surgical outcomes are actually worse because the reproductive tissues don't fully differentiate. So for girls, the breast tissue is undifferentiated, so it's hard to determine when the bilateral mastectomies are being performed what is breast tissue and what's healthy surrounding tissue. And with the boys, of course, with the lack of penile development, there isn't enough surgery, there isn't enough tissue when they're doing the genital surgery for the graft donor site and the what they call the neo vagina to be formed. So they're actually having to go. So actually, blocking puberty is resulting in worse outcomes when these kids are adults than if they had been allowed to go through their puberty.
Yeah, absolutely. And, this also speaks to the focus on getting a good result, whatever that means in adulthood. And in order to do that, they say they have to start early and they want to, push for younger and younger ages. But what they don't consider in that kind of reasoning is that the majority of children will spontaneously desist once they
Right.
move through puberty and they've resolved some of those developmental problems, a major one of which is their sexual orientation. So they're actually transitioning children who would never have declared themselves transgender, except for the social contagion and the incredibly aggressive marketing and propaganda that they've been exposed to. They would have struggled with their sexuality until they realised that perhaps they were gay and they needed sensitive support to work through that realisation. And
Right.
had that happened to a great number of young people who've transitioned today, it would be much less of a problem. So, yes, I agree with you. They're talking about these marvelous outcomes as adults. And, that means that they're going to pass a lot better as the opposite sex and they're going to have the most wonderful life. But they don't tell you that the majority of these young people will be medical patients for their entire life because there are so many complications arising from injecting into their bodies synthetic testosterone and estrogen. And their bodies and their genetic makeup were not meant to absorb those cross-sex hormones. So half-truths again that the whole ideology is built on.
What are some of the effects of an XX individual taking testosterone and an XY individual taking estrogen? What do we know about how the effects of their physical and emotional development as they go from teenagehood into adulthood? Like, are they becoming more emotionally stable?
Well, there are a great number of side effects, and I'll just go through a few. Um, to start with, girls being injected with testosterone, um, obviously there's going to be a suppression of menses due to the inhibition of gonadotrophin production and ovarian function. And that happens within the first 2 to 3 months, depending on how the testosterone is ingested, because it can be a gel, it can be a patch or by injection, and the injection is more intense. So the timing is different depending on the type of delivery. But some of these young people also suffer from persistent menses and unexpected vaginal bleeding once they've started testosterone, which they're rarely told about. And if they stay on testosterone for any length of time, then they become permanently infertile due to ovarian and uterine atrophy. And they also become not only infertile, but unable to function as a sexual being, as an adult. And that's because the vaginal epithelium becomes very thin and it makes having sexual intercourse extremely painful because the skin around that area becomes easily lacerated. So there's a great deal of pain. And then there's a loss of sexual desire or sexual arousal and the capacity for orgasm. And overall satisfaction is significantly decreased in a number of young females. Um, so it is a really terrible thing, to put yourself through unnecessarily.
Is there a difference between children and adults with the effects on the psychosocial development and sexual gratification experience?
I've focused all of my work on children, children under the age of 18. Um, but I do have in my clinical practice a number of transgender adults, and I can't generalize from the few that I'm seeing clinically to make a global statement. But what I can say is that a lot of them don't appear interested in pursuing a sexual relationship. They gradually become more interested in finding a tribe and companionship and like friends, like peers. Um, I don't want to press this point because I haven't looked at the literature on it, but what are your thoughts on that?
I haven't been able to find a lot of literature on it. For me, 4 years into the process, I was no longer interested in dating women.
Right, right. Okay.
Yeah, I didn't want to be at that time in my life seen as part of a heterosexual couple. And also, I just found the whole way that women approached me when they thought I was a man as something that was unpleasant. And I was surprised to find that out. How many people find that? Like, how many women find that they have over time a deep disinterest or decreased interest in being in a sexual relationship? It was counterintuitive for me that my sexual response when I was on testosterone actually steadily decreased the entire time I was on it. Because there's this idea that testosterone drives your sex drive.
Yeah, it is really counterintuitive, and it would be a very interesting topic to study a bit more systematically, because I'm sure that perhaps other people have had a similar experience to you. And I can certainly speak for the few transgender adults that I've been working with. Um, yeah. Um,
For me, like on a personal level, I had an awareness of the illusion and I didn't like the feeling of being exposed.
Yeah, that is a very common phenomenon that I see that even if a transgender person becomes romantically involved with another person, they are very sensitive and embarrassed about being naked in front of another person.
Yeah.
Uh, so there are lots of complex interpersonal and intrapersonal factors that are affecting the capacity of young transgender people, or transgender people generally, to experience intimacy. Um, so I think one of the things that isn't talked about enough is the experience of loneliness. Um, that there are barriers to intimacy because some of them don't want to identify to other people as trans. They said they just want to pass and to blend in, but they can't pass or blend in when they've got no clothes on, in intimate situations. And so they avoid those kinds of situations. And it forms a barrier between them and others because they can't be honest about a fundamental characteristic of themselves. So I'm sure there are lots of issues on top of the ones that I've identified in adolescence that occur in older transgender people. One of the things that isn't talked about, and you have to go into the specialist medical literature in the field of urology, for example, which is a medical
Right.
specialty that focuses on the diagnosis and treatment of diseases and conditions related to the genitourinary tract, which includes the bladder, the urethra, ureters, kidneys, and the male and female genitals, and the prostate gland. They treat a
Yeah.
variety of conditions, one of which is urinary incontinence. And young women taking testosterone often develop pelvic floor dysfunction and incontinence. And one study showed that 67% of women on testosterone in large enough quantities to transition experience this problem.
Have researchers tracked whether this has anything to do with having had a hysterectomy or not? Or is it just that they're finding it globally within the population of women taking testosterone?
My understanding is that it occurs as a result of being on testosterone. I'm sure a whole lot of other problems accrue to surgery. For example, trans men who decide to have hysterectomies. That's another whole layer of problems. But urinary incontinence is a really big issue that isn't talked about, and it does need to be addressed.
I had always assumed the urinary incontinence I experienced was a complication from the hysterectomy, because after the hysterectomy, they put in a catheter, which was there for, I think, 24 hours. So I assumed that there was a complication from that, as I began to experience the incontinence about 6 months after the hysterectomy.
Okay. Right. So you didn't see the incontinence developing um, as a result of just being on the testosterone. You felt that it was really tied up with the hysterectomy.
Yeah, because I had been like a year, not even a year on testosterone. So I would have hit my year mark about 3 months after. So what I'm thinking now is because the two overlapped, I just assumed it was from the hysterectomy.
Right, right. Well, I don't have the expertise to really comment on that, but it certainly sounds as if there are more than one way of um, women who are trying to transition becoming incontinent. And genital surgery is another way. So you've identified hysterectomy and we've identified testosterone in itself, and also genital surgery can result in these kinds of complications.